When can doctors ethically use therapeutic privilege? Imagine being in a situation where sharing difficult news might cause more harm than good. That's where therapeutic privilege comes into play. It's a tricky area in medical ethics. Therapeutic privilege is only used in very rare cases. It's when a doctor believes revealing certain information could seriously harm a patient's mental or emotional health. This is an exception to the usual rule of informed consent, which says patients should know everything to make their own choices. The main reason for using therapeutic privilege is to follow the principle of doing no harm. If telling a patient about a serious diagnosis might trigger a severe emotional or psychiatric crisis, withholding some details temporarily might be justified. For example, if a patient has severe anxiety and hearing about a terminal illness could cause a breakdown, a doctor might hold back that information for a short time. But this privilege isn't used lightly. It must meet strict conditions. First, the patient has to be capable of making decisions. They should be mentally competent, able to understand and weigh information. Second, the risk of harm from disclosure must be immediate and serious. If the patient might attempt suicide or suffer a mental health crisis, withholding information could be justified. Third, the withholding should only be temporary. The doctor should have a plan to fully disclose the information once the patient is better able to handle it. Fourth, the decision must be based on careful clinical judgment, considering the patient's unique situation. Lastly, the doctor's goal must be to protect the patient's well-being, not to manipulate or control their choices. This practice is controversial because it conflicts with respecting patient autonomy, the right to know and decide. Many ethicists argue that withholding information can damage trust and disempower patients. It should never be used just to prevent a patient from refusing treatment or facing difficult truths. In real life, therapeutic privilege might be used when a patient with mental health issues faces a grave diagnosis that could worsen their condition if told immediately. It could also be applied when emotional fragility makes full disclosure risky at that moment. For instance, if revealing a diagnosis might lead to suicidal thoughts, a doctor might hold back some details temporarily. Even then, the focus is on transparency. The goal is to eventually share all necessary information when the patient is ready. Doctors should involve ethics committees or multidisciplinary teams to ensure the decision is morally sound. To sum up, doctors can ethically use therapeutic privilege only when withholding information is essential to prevent serious, immediate harm. It must be carefully justified, limited in scope, and accompanied by plans for full disclosure later. This approach balances the duty to promote well-being and avoid harm with respecting the patient's right to know.